One more question about Main Street or looking out for the little guy. When you were governor of Texas, your state had the highest uninsured rate in the country. 1 in 5, more than 1 in 5 Texans didn't have health coverage, and yet you refused to set up a state exchange under Obamacare. You refused to expand Medicaid. I mean, is that looking out for the little guy when 21% of Texans didn't have health insurance?
Well, if how you keep score is how many people you force to buy insurance, well, then I would say that that's how you keep score. That's not how we...
But how about the flip side of it? How many people don't have health insurance?
Let me explain what we do in Texas. And this is a state-by-state decision. We make access to health care the real issue. We passed the most sweeping tort reform in the nation. We got 35,000 more physicians licensed to practice medicine in 2013 than we did a decade before that. This is an issue for me is about access to health care. And it's not about whether you force somebody to buy insurance. It's whether Texans have access to good health care. We got the Texas Medical Center, and physicians are showing up in places that literally we didn't have physicians to do those subspecialties 10 years ago that we do today.
Sir, but don't you, as the governor for 14 years, don't you feel some responsibility when 21% of the people in your state didn't have health insurance?
But that's not how we keep score. I mean, I think it's a fallacy to say access to health care is all about insurance. What we happen to say in the state of Texas is we're going to try to make as accessible as we can good quality health care. And that's what we've done in the state of Texas. You think all those people moved to the state of Texas because somehow or another they couldn't get health care? 5.6 million people added to the population rolls. Oh, and by the way, 1.5 million jobs created between 2007 and 2014. That's what people care about. They know they could come to the state of Texas and have access to really good health care, and government was not going to force them to buy insurance.